Well, good afternoon. Before I start, I want to take a minute to remember and honor the victims on the second anniversary of the Toronto van attack. In the face of this horrible tragedy, we came together to support one another as a community and as Canadians, standing strong and united in the face of a cowardly act of violence. And as I look back on that dark day and the unprecedented times we face now, the recent tragedy of Nova Scotia, I can't help but think that same strength, that same spirit will guide us through these difficult times. My friends, the days may be dark, but I can assure you, we're doing everything in our power to defeat this deadly virus. We're taking nothing for granted because we're facing an enemy that doesn't sleep, doesn't rest, doesn't take a break, so we can't either. Last Thursday, we delivered an action plan to protect our most vulnerable seniors in long-term care homes. Within 48 hours of launching that plan, we conducted thousands of tests, we delivered thousands of pieces of PPE, and put expert boots on the ground from our hospitals and healthcare partners. And I'm glad to hear that the federal government has approved our request for military personnel. We have literally called in the troops, and the cavalry is on its way. We're in the process of working with the federal government as we speak. We're carefully assessing resources they make available to us, and we will deploy those resources to where they're needed most. My friends, we're fighting this virus on all fronts. Nothing is off the table. That's why I asked Minister Smith and his team to develop a full strategy to protect all of our most vulnerable Ontarians. And today, I'm pleased to deliver our COVID action plan for vulnerable people. This plan builds on the actions we've already taken to protect staff and residents in group homes, in homeless shelters, in women's, children, and youth shelters, and those serving vulnerable Indigenous people. We restricted non-essential visitors. We provided emergency childcare to staff. We've delivered $148 million in direct funding through the Social Services Relief Fund to help these organizations hire staff, purchase PPE, and build isolation capacity. We provided $40 million in targeted funding through the COVID Residential Relief Fund. These funds were put in place starting in March to help homeless shelters, group homes, and other municipal services respond and prepare for COVID-19. And we are further protecting these vulnerable populations by ramping up screening and implementing mandatory testing at any outbreak site, including testing all transfers and new residents. We're deploying personal protective equipment to all staff in all congregate settings. We're conducting risk assessments, starting with our homeless shelters and group homes. We will limit staff to only work in one resident during this outbreak and provide extra training for staff so they know what to do in the event of an outbreak. My friends, we're all in on this fight, and that means getting resources and support to where they're needed. It means giving a helping hand, and I want to take a moment to thank our frontline heroes. Thank you to all the dedicated and hardworking staff who are working and helping those in need in our shelters and group homes across the province. Together we are stronger, and together we will conquer this virus. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Smith.
Thanks very much, Premier, and good afternoon. I'm happy to be here today to provide an update on the work our government is doing to support our vulnerable populations. But before I begin, I want to thank the ministers and their teams who couldn't join us here today, but worked day and night to get this plan off the ground. Ministers Greg Rickford, Sylvia Jones, Jill Dunlop, Steve Clark, and Lisa Thompson, and of course Minister Elliott, who is with us here today. We know there are immediate pressures facing congregated residential settings outside of long-term care. And we know homes serving those with developmental disabilities, shelters for survivors of domestic violence and human trafficking, homeless shelters, and children and youth residential settings are at higher risk for COVID-19 transmission. That's why today, our government is taking immediate action to build upon previous efforts to protect our most vulnerable clients in these homes and our Indigenous residential settings, both on and off reserve. Our Vulnerable Populations COVID-19 Action Plan includes a series of actions to be put in place over the next 48 hours and coming days that are targeted at enhancing screening and testing in these settings to stop the spread of COVID-19. Over the next 48 hours, a combination of enhanced screening and reduced exposure measures will stabilize outbreaks in many of these settings. To start, we will increase screening of both visitors, staff, and residents, make the use of masks mandatory in high-risk settings, and provide additional guidance and training in the use of PPE. And in certain high-risk settings, limit staff to working for just one employer. Next, we will address the need to control infection, manage outbreaks, and limit the spread of the virus. This includes enhanced testing, contact tracing, further limits on staff mobility, enhanced guidance of PPE usage and conservation, training and education on how to deal with an outbreak, developing alternate plans to move clients or close locations, and better supporting the province's homeless shelters. The third pillar of our plan will focus on maintaining staffing levels and managing staff shortages. Under our protection plan, we will stabilize the workforce, we'll protect capacity by leveraging workers with equivalent skills from other community agencies. As we implement this plan, we will continue to work across government and with our sector partners and agencies to explore additional measures that can be taken. I want to once again take this opportunity to thank our partners in the social services sector. I cannot put into words how much our government and the entire province appreciates you and the work that you're doing. Ontario and Canada is 100% behind you, cheering you on every single day. Thank you for everything that you're doing. And to all Ontarians who are doing their part, they're staying home to stop the spread or volunteering and donating where you can to support others, thank you for everything you're doing and your sacrifices. Together, we will conquer COVID-19. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Lisa Shing from CBC. Please go ahead.
Hi there, Premier. Premier, we're looking at more than 500 deaths in long-term care homes so far today. We heard from the Prime Minister today as well, and says we need to do a better job for the people in these homes and that we're failing them. Did you fail the residents in long-term care here in Ontario?
Well, when I think of the long-term care, Lisa, my heart breaks for the people and the families. Can we do better in the system? Yeah, the system, absolutely, but we're focused 100% on making sure we help the most vulnerable people. And Lisa, when I see, when I see the front page of the Toronto Sun, and you see a loved one with their elderly parent, and they put their hand up against the window, that's heartbreaking. I relate to it in our own family, as I mentioned, with my wife Carla, or the person that got on a cherry picker. Anyways, the system, we can do better.
Thanks, Premier. Just wanted to follow up on them, though. Did we fail the residents in long-term care in Ontario, considering we're seeing more than 500 deaths today?
Well, I think the system needs to be changed, and we're changing the system. But right now, our main focus is to make sure that we protect the people inside these long-term care homes.
Next question.
Next question comes from Siobhan Morris from News Talk 1010. Please go ahead.
Hi, Premier. My question's in a similar vein to Lisa's, just based on the Prime Minister's comments this morning. You talked about an acknowledgement that we need to do better for the people in long-term care.
Yeah.
How do we do better? Where is the system lacking, and where are we falling short that needs to be improved?
Well, I think I should pass that over to the Minister of Long-Term Care.
Thank you. So I want to give you some context. I'm a family doctor for almost 30 years. My own family went through this. My heart breaks for families that are affected by this, and the staff that is working so valiantly to fight against this virus. Our long-term care homes are truly on the front line of this war with COVID-19. And we've seen this across the world. And long-term care homes and the vulnerable people in them are our beloved residents in long-term care, impacted in a most terrible, terrible way. We began very early, as soon as we became a ministry, to look at staff issues, to look at redevelopment. We knew that this long-term care sector had been neglected for many, many, many years. And we were taking action to change that. And when the pandemic hit. And then we acted quickly. We acted quickly with active screening. We were one of the first provinces to do that. And then we went to essential visitors. We were one of the first provinces to do that. And then we made sure we added better staffing support, more infection control. We issued emergency orders to allow for staffing flexibility, and on and on and on, up to our most recent action plan. And now we're not afraid to ask for help. Our homes are struggling, and we've called in the military. We have used every tool that we had, and we've created new tools. And this virus, it's a war against COVID-19. And I thank everyone who is working valiantly to defend our most vulnerable people. And my heart goes out to everyone who's been affected by this.
Follow-up?
The Prime Minister also said this morning, I know you're talking about having called in the military, he says that soldiers should not be taking care of people in long-term care, and that is not a long-term solution. So knowing that, how can the people who have family members in these homes and who, as you said, are angry, are worried, how can they be assured that there is going to be a plan once the military needs to pull back, once we're out of a pandemic?
Mm-hmm. And that's what we were in the process of doing. And I was out regularly talking about our vision for long-term care, where people would go to live, not just to stay, and talking about a modern 21st century long-term care system that allowed people to be integrated with their communities, and where the staff in our long-term care homes would also be treated with respect and dignity, just like our long-term care residents. And that's what we were in the process of doing. And I think as a society, we need to understand why there was no interest in that process that we had begun. You know, we have to take a look at our society and understand we have a moral imperative to improve our long-term care system and allow our residents and staff to be treated with respect and dignity.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi there, good afternoon. Premier and Minister Fullerton, your government is planning to deploy these soldiers at 5 long-term care homes, and those homes you mentioned yesterday can change at any time. So there are currently 132 homes with an outbreak, and nearly 20 long-term care homes have recorded 10 or more deaths. How are you going to prioritize which home gets the military assistance and which home goes without? What is the criteria here?
Well, they're just working out those details, Colin, but I can tell you about the military. I'm just so proud of our Canadian Armed Forces. And when I talked to General Vance, you know, he told me, he said, Premier, put me in the most difficult homes there are, no matter what's going on in there. And I sat back and I thought, you know, these people are absolute champions, our military, our men and women. that can go into these homes and jump into a crisis. We aren't too proud to call in our military. We've called in volunteers, retired nurses, public health officials, hospital staff, right across the board. And I'm just so proud of our Canadian military. And you'll have those details over the next day or so, but they're going to be a big relief coming into the homes. There's just like there were a big relief in Quebec and other regions.
Thank you, Premier. And I just wanted to ask you, just along the vein of the previous question. So, as of today, 516 residents in long-term care homes in our province have died. That represents 7 out of every 10 COVID-19 deaths in this province. It's a staggering amount. What do you say to the hundreds of families of people in long-term care who have lost loved ones and who might be feeling right now as if their province let them down? What do you say to all of those people who may be watching or listening right now?
Well, my heart breaks for them. As I was saying, Colin, our family's going through it, along with 70,000 other families that have a loved one in these homes, and it's very difficult. I recognize that the system is broken, and we're going to fix the system, but in the meantime, the number one crisis is making sure that we take care of these most vulnerable people in these homes, and we're going to do it. I'm pushing the system constantly on all fronts, and we said we'd do more testing. We're doing more testing. We ramped up to over 8,000, close to 10,000 every day. We're going to ramp up to 14,000. We're going to continue all hands on deck, and we're going to fix the system.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Good afternoon, Premier Ford.
Hi, John.
Question for you specifically about the use of the Canadian Forces members who are going to be coming into these homes. The Registered Nurses Association of Ontario has said that they're puzzled by this move. They think that there are additional healthcare workers out there who could step in and would be better suited to help perhaps than the Canadian Forces members in these situations. I'm wondering if you can address that concern, and what are these Canadian Forces members going to specifically be doing in the homes?
Well, I'll pass this over to the Minister of Long-Term Care, but they're going to be there to support the frontline healthcare workers in any capacity that they can. We need people, and if we need more nurses. If the nurses, by all means, they contact us, they'll be in a home immediately. We need all hands on deck right now. It's a critical time, a critical situation that we're facing, not just here, around the country and around the world. But I'll pass this over to Minister of Long-Term Care.
So I am very, very grateful to the Canadian Armed Forces, to our military, who will be coming to support our most affected long-term care homes, to help our staff in their fight against COVID-19, give them the support that they need to care for our residents. Very vulnerable people need the support of our long-term care home staff, and struggling for a number of weeks now, some homes in dire need of staff, despite our best efforts, allowing the acute care sector with hospital staff to come in, along with home care staff, along with the portals that we had created, along with the federal portals and the nursing volunteers. It still was not enough. And there was too much risk that our loved ones would not get the support they needed. So that's why we reached out to the Canadian Armed Forces, and they've heeded the call, and we are very grateful.
Follow-up?
Minister, also the province has extended a number of emergency orders today, including the order that restricts workers to one home. I'm wondering, and please correct me if I'm wrong about this, but it does not appear that the government has included temp agency workers in that again. that they are still exempt from that order. I'm wondering why that is. Does that not defeat the purpose of that entire order at all?
The agencies have been an important source of staffing. We were coming into this pandemic with shortages in our long-term care homes of staff, and that's why we had a study and expert panel put together to address what more we could do to improve the staffing in our long-term care homes, and that was an ongoing effort. So the staffing shortages preceded this. The agencies that provided staff were an important measure to make sure that our homes did not go without staff to support our long-term care residents. It's a balance of risks, but it was something that we had to take seriously given what we've seen in other countries.
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Good afternoon, Premier.
Hi, Robert.
This morning you extended the emergency orders, as Sean was just mentioning, to May 6th, basically ensuring that all non-essential workplaces will remain shut. We're hearing from a lot of industries like garden centers and Canadian Tire stores, things like that. They're wondering why they can't be open. Is it possible that those kinds of things will be open before May 6th, or are those going to stay closed for at least another 2 weeks as part of the pandemic closures?
Well, Robert, you'll be hearing about that over the next day or two. We'll be rolling that out.
Follow up?
So that's a really short answer, Premier.
No.
So maybe I can get a third question then. Does that mean that we'll be seeing, it's giving some hope to those industries? Because, for example, the garden centers, they are an agriculture industry, and they grow their things on farms in Niagara and other parts of the province. They're wondering about what's going to happen to all their products, their plants. And they're not food per se, but they are farmed goods. So you'll have some positive news for them in the next day or so, you're saying?
Yes, we will, definitely, and I understand the situation they're in, and our government's going to act on that.
Next question.
Next question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Premier.
Hi, Randy.
I'm wondering, given the horrifying numbers of deaths that have taken place in long-term care facilities, and the inherent lack of transparency in those facilities, given that families can no longer go in and visit their family members, should you be sending teams from the local health units in to inspect every single long-term care facility in this province to make sure that they are operating up to standards?
Well, I'll pass this over to the Minister of Long-Term Care. I know we've done a tremendous amount of inspections last year, but I'll let her speak on that. Thank you.
So on top of the regular inspections, annual inspections, there were over 2,800 inspections in our long-term care homes last year. But above and beyond that, the public health units are actually and have been going in to our long-term care homes to assess the situation and evaluate it on a risk basis.
Okay, and I'd like to return to Anson Place, if I may. They claim that they have reached out to all of their partners recently asking for help in running their long-term care facility. Do either of the ministers there, the Minister of Long-Term Care or the Minister of Health, are you aware of them reaching out to your ministry to ask for help?
I believe that we have been tracking them as a concern, and they are one of our priority homes.
Next question.
Next question comes from Travis Danraj of Global News. Please go ahead.
Hi there, Premier.
Travis.
Considering there are over 500 seniors dead and you've had to call in the military, why does the government seem unwilling to say, yes, there may have been missteps early on in our response, highlight what went wrong, and take responsibility by saying how you're going to fix some of these failures moving forward?
Well, I can tell you the system, a lot of systems are broken down here, and I've mentioned it before. We're down here fixing the systems, and this is pretty clear. We can do better, and our number one priority is to make sure we put the resources that are needed in these long-term care homes. Make no mistake about it, Travis, the system. We're gonna fix many systems down here, no matter if it's long-term care or just the way the government runs. If it was, just Ontario, that this virus is terrible. It attacks the most vulnerable, and it doesn't stay within the borders of Ontario. You just have to look across the country and look across North America and the world. It's a terrible virus. We have to do a better job, and at the end of the day, the buck stops with me, and we'll make sure we get it fixed. But my number one priority is to make sure that we get the people the help that they need right now, and that's what we're doing.
And my second question is on a different topic. Considering the financial toll this crisis has taken and will continue to have on municipalities, will you amend the Municipal Act to allow them to run operating deficits, or are you prepared to bail out cities like Toronto so they won't have to hike taxes?
Well, Minister Clark is working on that right now. He's in touch with the 444 municipalities, small, medium, and large, and we'll be sitting down with all of them. Again, we're going to ask the federal government for the support. We have a certain capacity within any province, not just our province. And as my finance minister always says, and I've said it before, the federal government has a printing machine, and we don't have that printing machine. And I just want to thank the federal government. They've stepped up huge for everyone across this country. They've always been there. We put a request in, they step up. So we'll be working with the federal government along with the municipalities and the province. And I think between the three of us, we can come up with a solution that works out well for everyone.
Last question.
Last question comes from Sabrina Nunji from Queen's Park Today. Please go ahead.
Oh, hi, Premier. Thank you for taking my question. I'm wondering if you can give us a sense of where you'd like to be in terms of testing and contact tracing before we start to open up parts of the economy again.
Well, our next tier is 14,000 tests a day, and we want to continue on with the 14,000 tests a day and contact tracing equal to that. We have to make sure we pick up the contact tracing alongside with the testing. But I'm really proud of our health table and Dr. Williams and everyone around that table. I was a little frustrated a few weeks ago, and they did a great job, and they picked it right up to 10,000 a day and 14,000 by the end of the month. So I want to thank them for doing a great job. And we're going to continue. We aren't going to stop. We're going to continue working day in, day out, around the clock, literally around the clock, to make sure that we test as many people as possible, especially in the high priority areas.
Thank you. And if I can follow up on a slightly different subject, officials said this week that they were turning an eye to bringing back some of the postponed surgeries because hospitals haven't really been crushed with this wave that had been expected. Can you tell us the timeline for re-ramping up these surgeries and what that could look like? Will some surgeries take precedence, for example?
I'll pass this over to the Minister of Health.
That is something that we are considering right now at such time that we are able to start loosening some of the restrictions. I know that many people have been waiting for surgeries, particularly cancer surgery, that we want to be able to start those as soon as we're able. But as we know, there are certain things that have to happen before we can do that. One is to get the testing up to the levels that we need, the contact tracing, the surveillance in the community in terms of testing asymptomatic people, but especially getting the numbers of cases down. We actually are continuing to see cases well over 500 on a daily basis. We need to see that number go down, because we are at the peak, meaning that we have hit the maximum numbers of cases. we expect here in the province, but we need to see those numbers go down before we can start getting into things like surgeries that have been postponed, opening up parts of the economy and opening up parts of society. So we still have some work to do, but it is something that we are planning for already.
Thank you.
That's great. Thank you, everyone.